It's an athlete's worst fear to be out on the field and suddenly feel a sharp, painful strain in their leg. Their stride was broken by a torn muscle, and with appropriate rest and rehab, they'll be back to their daily routine in no time. However, not all injuries are so straightforward, such as those nagging chronic pains you feel every time you go out for a jog or bend down a certain way. So how do you know when it's time to go see a physical therapist? In this presentation, we'll tell you 3 telltale signs that may indicate you need physical therapy. The first is if pain lingers after 3 to 4 days of rest and ice. After an injury, the best things you can do are rest, take a break from the sport that caused the injury in the first place, and ice several times a day for 20-minute intervals. Once the symptoms seem under control, you should get back to your sport and see if they're gone for good or if they return. Injuries that fail to heal with proper recovery and rest may require the help of a physical therapist. The second sign is if you have recurring, dull pain. In general, experiencing sharp, centralized pain is a clear sign to go see a professional. Pain that severe could certainly be a sign of a more serious injury, such as a muscle pull or fracture. However, there are other signs that your body will give you that are often overlooked. If your pain is dull and lingering and does not diminish with rest and ice, it could be a sign of a more serious injury. In these cases, the nagging pains won't subside until the underlying injury is addressed. Examples of such underlying injuries include severe strains and imbalances between muscle groups. The third sign is if you have a traumatic injury. If you watched yourself roll your ankle or felt a sharp pain during that landing, it could be time to go see a physical therapist. Here's what to do next. To reserve your appointment, call 800-754-0488 or schedule an appointment online at manhattanphysicaltherapy.co. Our experienced staff will assess your condition and set up a treatment plan to get you back on the field.